I'm sure we'll be fine. So, thank you very much, Chairman, ladies and gentlemen, for inviting us today from Ireland. Our proposition is, how do we turn off paper? So you've heard some detailed conversations about big data already this morning. In Ireland, we believe we're in a very similar position to Greece. Our starting point has been very similar. Our end point that we want to get to is very similar by moving from paper healthcare to a big data supported healthcare, to a healthcare system that can be supported by digital. I work in a healthcare system that looks after 5 million people, that has over 14 billion euro as its budget. And yet this is our healthcare system. This is Ireland's big data. It's kind of difficult to turn it into some of the suggestions and conversations we've had already this morning. How do we actually create the ability to move to the 3 V's that was discussed in the previous presentation when we're still looking at this amount of paperwork in the systems we have? What is interesting for Ireland, though, is it started to understand a different way of moving. The world has never been changing so fast, and I think the conversations this morning already have shown, from a digital point of view, we are moving at a rapid pace. The size of data in the previous conversation is huge. But one of the things that we propose now is, without a longer plan, we can't change. The picture you see behind me is Singapore in 1969. In 1969, the people of Singapore decided that no matter what happened financially or politically, they would create a business district. So regardless of financial situations, regardless of changes in political persuasion, regardless of anything that happened in the district, they went from that previous black and white photo to this. This is the Singapore Business District today. So one of the things we now propose is, how do we move from investing 1% of our budget into digital health to a more normal EU budget of around 3.5%? How do we look at different businesses? The financial sector, which is across the EU investing around 12 to 15% of its budget in digital. How do we do more? When will it come to health? We talk a lot about big data, and that's been the conversation that we've had so far this morning. There's a great book that I can't highly recommend enough from Martin Lindstrom, which talks as much about small data, not in comparison, but in actually what we do with the data. There's this concept of actually looking at how we use data, how we use information. How do we predict change, not just by looking at the wealth of paper about a patient, but the context that the patient lives in. How do we change what we do? And Martin, in his book, looks at subtext research. How can you actually begin to not just take big data and do things with it? How do you get different clues from there? As a clinician, how can you use these different words to actually provide a different type of care? We consider that actually moving from personalized care to contextualized care is where big data and the use of it will allow us. Most people in the room today have got a smartphone in their pocket. Most people in the room today like to publish, like to put information out into the systems we have. And that becomes a big part of what we're trying to do. How do we become publishers and then use that information? How do we turn data that exists in the patient's hands into something that is useful for healthcare? And that is a big part of where we're trying to move to. Lots of people in the room, I'm sure, are on Twitter, Facebook, on social media more generally, considering how they can be part of their healthcare system. Social media, the information in the social media world, is useful for healthcare. We can predict things that happen through social media. And maybe that is the place that in 2016 we moved to. One of the most interesting studies recently in Ireland, though, was around clinicians using a mobile phone. If you're a doctor in an Irish hospital and you take out your mobile phone to look at data, then you're working. If you're a nurse in an Irish hospital and you take out your mobile phone, the patient believes you're on Facebook and you're not working. It's kind of scary that we also have to change patients' perceptions of what we're doing as we get there. Our starting point in Ireland to move from paper to big data is low. I visited a primary care centre, a GP, recently, and spoke to a nurse on a Monday morning at 8:30 who had the tools of a schoolchild: pen, paper, and a ruler. She was creating literally a rota for the week. Moving from that kind of situation of tools and data, is a huge piece for Ireland to move to a digital solution, but it's something we've started to do. Microsoft gave us a term, digital fabric, a solution that we've started to use as we engage clinicians. How do we move so that people of Ireland are part of that digital fabric? How do we have a width of appeal of what we do? How do we make it secure? How do we make it attractive? And how do we make it resistant to change? The Irish healthcare system will continue to evolve and change, as will most countries. We need to make our big data solutions capable of moving in that way. And therefore we created a plan, a knowledge and information plan, not a big data plan or a technology strategy, but a way to actually embrace 5 pillars across how we deliver solutions, concentrating very much on not the technology, but on the engagement of clinicians and the work we need to do. There is a vision across what we're trying to do, which is as much about economic opportunity, again, as has been discussed twice already this morning, as it is about delivering healthcare to patients. After all, healthcare invented business intelligence. Healthcare invented analytics. In 1854, Dr. John Snow is said to have been the first person to document the use of information and use it to change people's mindsets. Cholera was killing people in London. He went with a long list of the people that had died to the UK government to say it wasn't ships arriving, but a pump in Soho. They didn't believe him. It was just a long list of names. He took a map, he plotted where that pump was, showed the UK government, and had that pump handle removed. He used analytics, big data, and business intelligence to save lives. If you're ever in London and you're in Soho, look up the Dr. John Snow pub. You can go and touch the handle that invented healthcare analytics. 4 cows behind me. One of them creates more milk to the tune of 600 millilitres a day than the other 3. Not because it's a black one or because it's fed differently, but because of how people look after that cow. This isn't just me making it up. This is a university study done twice by different universities to prove and understand how treating people differently, using information to elaborate how we interact, has changed the production of even milk. Using information to do that changes the way we work. We've tried very much in Ireland, having only been on this eHealth journey for 2 years, to look at what's been done wrong and right in other countries. I think back to that first slide, the differences between Greece and Ireland are quite unbelievable from what we've focused on first and what Greece has focused on first to deliver. And yet by sharing through meetings like this and the ecosystem, we can learn. Ireland has a principle which is there will be no more IT projects. We have 200 clinicians that now lead business change projects delivered by technology. Clinicians that understand some of the concepts spoken about already around big data and are now leading the charge to make sure benefits are delivered into the healthcare system. Some of our biggest successes over the last 12 months. The Ireland now has an individual health identifier, a unique identifier for every patient in Ireland. The ability to refer a patient from a GP into an acute hospital. An electronic health record for maternity, a single lab system, and a number of other solutions, including genomics of patients with epilepsy. Taking different lessons, looking at how data can be used, is a big part of where we try to go. But the next 12 months is a huge leap again for Ireland as we move to give people who work in health a digital identity, the ability to simply log on to solutions. 109,000 people work in health in Ireland, 47,000 of them cannot access IT, and we have to fix that. To do that, we've moved very much towards a cloud infrastructure. Ireland is the first EU state to have a cloud first, a health cloud for all our systems, a way of actually moving us on and allowing us to move forward. And the computer has now frozen. No, it's not. There we go. Because this is where we are today. This is our medical records room. This is one of our busiest hospitals in the west of Ireland with the information of yesterday, today, and tomorrow. This is how we manage integrated care. By having a health cloud, we can now store this information and start to truly move to a solution like this, where digital answers can be provided through big data, through how we manage referrals, through how we connect the patient to their own information, uniquely and securely identifying the patient and allowing them to have access to their own information. We are about to embark on an electronic health record, a huge investment, €1 billion of investment over 9 years, but not one single database for Ireland, a connection of solutions. Again, looking at how we connect data, not create one big data solution. But it's a 10-year journey. It's a long journey. And keeping engagement and keeping people part of that 10-year journey is a huge challenge for any healthcare system. I think there are huge lessons to be learnt from the electronic prescribing solution deployed in Greece and how we can start to do something similar in Ireland. And equally, the lessons that we've learnt over the last 2 years around referrals, identity, and the EHR can be shared. We now engage strongly with innovation, with startups, with new organisations across Ireland. And if you're here over the next 2 days, we'll explain a little bit more about those in other presentations as we move through. We have a very open and transparent nature. There are 2 contact details on the wall behind me. Myself, from a technology, from a business change point of view. My colleague, Yvonne Goff, is our Chief Clinical Information Officer. Any clinician that wants to know more, understand more, or become just partners in what Ireland's doing, then get in touch with us through any of those means. I hope that's been useful and given you a bit of a different flavour for a different country's journey. Thank you very much for your attention.